Is it fine?
Yeah, but your voice is feeble. I'm not sure why. Um, is my voice feeble as well?
No, no, your voice is fine. How about now? Is it good?
It's audible, but it's very low. I can manage. I have to be maybe I have to hear up close. It's all right.
Okay, let me just try something else as well. I will try to speak up more. We'll just wait for a couple of minutes so that others join us as well.
Sure,
And just 2 minutes and then we will start.
no problem. No problem.
Welcome, Aisha. All right. I think we gave enough time. Let's start. Others can join on the way. Uh, Welcome, Dr. Shriram. How are you?
I'm good. I'm good, Dr. Mustafa. How are you?
I'm doing fine as well. Thank you so much for making it today despite your busy schedule at the hospital. I hope everything was good. How was your day?
It was all right. Not bad. Usual day's work.
Okay, that's really great to hear.
Yeah.
Just before we, could you just give a brief introduction about yourself so that our viewers know who you are?
Sure, Doc. So, my name is Dr. Sriram. I am a second year internal medicine resident at Tawam Hospital Alain, which is under the SEHA umbrella in partnership with Pure Health. I was a graduate of the Russell Khama College of Medical and Health Sciences in the year 2018. That's when I passed out. Following which, I was a general practitioner for roughly about 18 months before I got selected for the residency program in Tamam Hospital.
That's wonderful. It's a pleasure to have you on board because there are many people who are appearing for this process and are quite confused on how to choose their specialties. I think this session will bring them more insight about how internal medicine really works. So, before we just get into that, I want to ask you, why did you choose internal medicine?
So, I chose internal medicine because it is a specialty that I love. I did not choose because I was forced to or based on circumstances. Uh, I would just say that it is based on something that I love, and it is my first choice, of course. So that is why I chose internal medicine.
That's wonderful. Do you feel that internal medicine is a competitive program?
I believe so. It is a competitive program like any other program you apply to. Of course, there are variances in the number of seats. I'm happy to say that internal medicine program in Tawam Hospital has 14 seats, and they are talks on planning to expand more intake. in the coming years, starting from this year, I believe. But these are just talks. Officially, it is still 14 seats. So I'm happy to say that we are more of a friendly specialty. But yes, it is competitive like any other specialty.
All right, that's wonderful to hear, Dr. Shri. Uh, Another question that aligns to the same perspective is: did you have any other options to choose for residency apart from UAE, or was this your first option?
So to be frank, I kind of you kept UAE as my first option because I mean, life circumstances have kept me here for the time being. So I have decided to use this training program as an experience. So I am making the best out of it. And it is a wonderful program, and there are many, what do you say, it has a good prospectus.
All right. You said that you worked as a GP as well once you graduated medical school, and now you're working as an internal medicine resident. What do you feel like this program has brought into you, or your experience as a GP has brought in some changes into this program for you in terms of education or in terms of work? So, if you could elaborate on that.
Right. So, in terms of the experience, I have to say that the internal medicine program has inculcated a practice called evidence based medicine. Now, for
Okay.
general practitioners practicing in the UAE in private and public health sectors, I have noticed that, including myself, from personal experience, that evidence based medicine practice is not up to par. Having said that, joining in this program, we practice something called as evidence-based medicine, where we use up-to-date for updated guidelines and latest guidelines from various medical associations, which follows latest updated, safe and practical medicine. So that is something that I've noticed in this hospital.
So usually we have two broad specialities like internal medicine and general surgery, which are usually termed as toxic if you ask residents all over the world as a general term. So what's your take on that?
I think it's on a case to case basis. Of course, any specialty like internal medicine, surgery, for example, uh, pediatrics, OB-GYN, anesthesia, any residency program you take in Tawam Hospital or any other training teaching hospital, it depends on from person to person. The environment is, I wouldn't say toxic, I would call it stressful. Yes, because it's a core specialty, it's a general specialty. You are covering all areas of adult medicine and you are seeing the case firsthand, and you will follow up this patient from the time of admission until discharge, going through your list of differentials based on what he or she came in with. So, it's like doing a detective's work. And it depends on the patient load, but I wouldn't call it toxic, to be honest. It depends on how you look at the specialty and how you treat the workplace and how the workplace treats you back. I think it's an interplay of these factors.
Perfect, perfect. That sounds amazing, by the way. As an internal medicine resident, you have completed more than a year now. Uh, what is expected out of a resident once you join this program? Like, for example, I'm a fresh graduate, or I just finished internship, or I just finished a GP job. What are the things that am I looking for that I should have prepared before I join this residency program?
So, before joining this residency program, you have to show your interest in the specialty. Uh, for example, doing electives um in the Department of Internal Medicine at any hospital, any teaching hospital, preferably. Um, that's one case. Second, if you during your internship happen to publish or happen to uh, display your oral or poster presentations at any conferences during your medical school and internship career, that is a big boon in your CV. A lot of the interviewers, they look at that, especially the research, because research in internal medicine especially is very important. So my humble suggestion to internal medicine aspirants would be to please have any one experience will do in research or case reports, case series, whatever it is that that helps in updating the medical literature for the readers around the world, generally speaking. So that would help in your CV. In terms of those who are practicing as GPs and are willing to join into internal medicine, the experience wise is of great advantage because you are building your independent practice. Along with that, if you have research or extra academic or extracurricular activities that is apart from medicine, like volunteering services or attending conferences, taking part in any health campaigns, all of this would give a holistic picture that yes, someone that you are likely to be ranked and be taken into the program.
All right, that's very clear. By the way, since you said that you worked as a GP for a year before you joined medicine, so I'm sure that the program itself has residents of varied uh, criteria. So, is there any specific thing that there is some age focused people that are accepted, because some would be just recent graduates or some would be having experience in the field of work already as a GP?
Um, to be honest with you, it doesn't really matter whether you have experience as a whether you have had a GP experience or not, because I have seen my junior colleagues who are first year internal medicine residents. Uh, it's a amalgamation of those who have had the GP experience, those who have had a research experience, and those who are just fresh candidates after their internship. It all depends, like I said, on case to case basis. They don't really, look into detail, but of course, having, like I said, research experience or electives in the Department of Internal Medicine, GP experience, all of these play a role. You do not have to have all of these, but if you have any one among these, that's beneficial to your CV.
All right, perfect. One other question that is very common is that every program is usually evolving. They're becoming better day by day. It's because of teamwork that organizes the knowledge and education for the residents. Do you feel that your program is still struggling with something, or internal medicine has something to advance in, which the candidates can look for or they can prepare for? Like, for example, you're having some researches to be done in like genomics, evidence-based medicine. So, are there any limitations in your program that you feel candidates should worry about?
Um, Limitations of the program per se, I would say that the for those who are non-Arabic speakers, I think the language would be a limitation to them, and they have to upscale their occupational language efficiency. In terms of research, we are now becoming more research oriented. I have to say, in the last couple of months, I have noticed a trend after the leadership of the program has been changed for other reasons. But I must say that the program is becoming more research oriented, and it is mandatory that those who are in the program must have a research project ongoing. It doesn't have to be, complicated research like randomized control trials or meta-analysis. Or it can be simple as a case. I'm sorry, case control or case cohort. It can be a descriptive study such as a case series or case report, or a cross-sectional observational study. Uh, That is mandatory for us residents to have as we progress through the program. It's also mandatory for us to graduate from this program. In terms of education and learning, I must say that compared to last year, this year, a lot of educational activities have been brought into the program. Every day, for 5 days a week, Monday through Friday, we have various academic activities. If I can elaborate in great detail, on Monday we have a case presentation from any resident who saw a nice, interesting case during their admissions on call. Tuesdays we have challenging case wherein those who have admitted or those who have witnessed a case, while working up this case, you found something challenging or contradicting in your theory. You can present that to engage the audience and engage them to learn as well. On Wednesdays, we have students or interns presentations. Thursdays, we have pharmacy department who give us presentation on important new coming medications. On some Thursdays, we have journal clubs where we review and critically appraisal of a paper. And Fridays, we have the IMTU presentation, which is basically internal medicine teaching unit presentation, in which those who are covering general medicine rotations, like I myself am covering general medicine rotation now, we presented a case we saw in the ward past week. So, we have various educational activities. Along with that, every Wednesday, half a day every Wednesday, we have the academic day. We are sent a schedule in advance, so we anticipate what topics are going to be discussed. So we have various educational activities apart from the practice that we do in the hospital. And in addition to that, we have research obligations as well. So I would say that they're really training us to become great academic physicians, so to speak.
All right. Okay. Since we were talking about research, just a bit more detail in that, are the candidates more supervised to do research, or the candidates are left on their own to find maybe a research project and to go about it, or is it well monitored for candidates to improve in research?
So a research is mentored, number one. Number two, the research, it's preferable that in the program, it's preferable if you have your own project, if the idea is yours. But like I said, it's doesn't have to be mandatory. Of course, you have a mentor and you can assist in any ongoing projects if you are lacking your own ideas or resources to come about on your own. Otherwise, you can assist and decide on the co authorship and assist in any projects.
All right, perfect. So we have been talking about research, we have been talking about candidates applying to this program. Would, and I'm sure that most of them would be having similar kind of caliber and eligibility. How does a candidate stand out when applying for the program?
I'm sorry, how does a candidate stand out?
When applying for this program, how can he just outdone himself?
So, I mean, frankly speaking, it's 99% of your hard work and 1% of your luck. Just focus on that 99%. Like I said, strengthen your CV by doing electives, by doing research. If you have a case report, if you came across an interesting case that is an internal medicine case, you can write up. That's very helpful. If you have any ongoing research projects with your mentor, you can mention that in your CV and even prepare a small PowerPoint and or a small poster and you briefly talk about it if you're selected for your interviews. Extracurricular activities, not everything has to be academic or related to your work. It can be extracurricular activities like volunteering, going for health campaigns, stuff like that. That helps. So you want to make your CV look holistic. That's one aspect. The second aspect is your Emory scores. I heard from many colleagues that the Emory score requirement is increasing, and I believe now it's I think 80% or 85%. I'm not sure exactly what is the cutoff, but I still believe that Emory is not the only criteria for selection for to be for yourself to stand out of those applicants to be selected for the interview. um, During the interview, it all depends on how the interview will go. Interview is all about getting to know yourself. So you represent your CV, talk about your love for internal medicine, just openly talk about what you did in this department. Like, I did research, I did electives, I did experience. For those who are GPs, I did GP in this department under internal medicine. So all of this will add benefit in one way or the other, and this is all under the 99% spectra. The 1% spectrum is all on luck, and by God willingly, you do your best, you will get it.
All right, that sounds great. Also, when you're applying for these interviews, do you recommend this program to locally graduated individuals or to foreign medical graduates as well?
I recommend this program to all those who are aspiring to practice internal medicine in the UAE, especially if you want to come to Tawam Hospital, because in Tawam Hospital, you see the rarest of the rare cases. The environment is very, again, I wouldn't say toxic. The environment is daunting in the sense that you get a lot of experience and you will come across many cases, because Tawam Hospital is the only government teaching hospital in the Alain region. The other hospital being Alain or Al Jimi, it's available to elective cases and predominantly COVID cases. So everybody comes to Tawam Hospital. You come across genetic diseases, you come across metabolic diseases, you come across various medical ailments. So join this program if you are an internal medicine lover, and you will learn so many things in so little time, but you will learn and you will pick it up as you progress through the years, and you will rise up to the top. So do join this program if you're interested.
All right, perfect. That sounds really nice. Currently, in your program, do you have foreign medical graduates as well?
In my program, well, we had one resident who this is a true story, by the way, and he's a very dear friend of mine, my ex senior. I met him when I was an intern in Tawam Hospital 2 years ago, 3 years ago, I think. Uh, he is now an attending physician in the Department of Nephrology at Houston, Texas. This
Wonderful.
guy finished his undergraduation in Bahrain from the Royal College of RCSI in Bahrain, off campus. He did his internship there. He was told to do his internship again in Tawam Hospital because there was a gap in his experience. Otherwise, he wouldn't be. He was not required to do it. So he came from another country. He's a Pakistani national. He came from another country, GCC country, into the UAE. Uh, did his experience in Tawam Hospital, earned the respect and the recognition of the department, applied for the program in Tawam Hospital. He finished his residency. He gave his steps to pursue fellowship in the Department of Nephrology at Texas. He was selected there. He did his fellowship, and now he's an attending physician over there. So
Wonderful.
there, people are welcome to all. We have had graduates from China, not Chinese nationals, I must add, but there is one doctor who just finished his residency program here. He's a graduate. He's a graduate of Guangzhou, I think, Guangzhou University in China. So we welcome all.
Wonderful, wonderful. I mean, this story itself would actually make most of the candidates secure enough when they're trying to apply, because there's a huge confusion and misinformation out there that with pertaining to who gets into the program, but I think it's a very big open space that any aspiring candidate can apply and get their equivalent chances as well. That's really wonderful.
If I may add, if I may add, Dr. Mustafa, for a candidate to stand out, I must add one important thing. If you're a non-Arabic speaker, please do learn some occupational Arabic, because you will be asked in the interview to take history in Arabic or do counseling in Arabic. So do your best to catch up with the language,
So
because I
it's
was
all.
asked in my interview.
Is it? Oh my God. Okay. Because it's a bit difficult to grab a new language. But I feel like, as you mentioned, the occupational Arabic is when you get through some words or phrases, then you can formulate at least.
Definitely, because majority of the patients we see in the department in the wards are Emiratis, followed by non-Emirati Arabs, and a very minor proportion of Asian population. Of course, most of because where we are being rotated, we come across a majority of Arab speakers, and a majority of the population in Alain are Arabic speaking people. So learning the language is a big boost to your CV and to your interview as well. So you could stand out in terms of that.
All right. There's one more thing about the, rotating in a department is since you're a resident, you would obviously touch base with multiple departments. Like I think you would be going to nephrology, infectious disease, gastro, and many other departments, right? So, how do you feel is the hands-on experience or for a resident when they are doing things on their own? For example, if it's during a shift in the ward or they're covering a night shift. So, how is the hands on experience for residents?
The hands-on experience for residents in the program is phenomenal. Um yeah, I have to say that it depends on opportunity basis. Uh, excuse excuse me. So if you have an opportunity to do an ABG, an arterial blood gas sampling, go ahead. For example, in my personal experience as a resident currently, during my on calls for the wards and for the admissions, I do arterial blood gases myself. We have respiratory therapist personnel who bring the ABG kit, and we do it in their presence. In case we struggle or we fail, they are there to guide us. Predominantly, it's their job, but we do it for our learning. In addition to that, I have done more than 5 lumbar punctures during my residency. So I can say that I'm competent in doing an LP, of course, under the supervision of a neurologist or someone who's experienced, because you are still a trainee. The other case being a diagnostic pleural tap, which I did during my pulmonology rotation. So department wise, you will get a chance to do procedures. When you're in hematology or neurology, you will do LP. When you are in pulmonology, you will do diagnostic pleural tap. When you're in gastroenterology, you will be able to observe endoscopies. You will be able to observe or assist in ascitic tapping, abdominal paracentesis. When I was in cardiology, I did under the supervision of a cardiologist. I did synchronized cardioversion for someone with hemodynamically unstable atrial fibrillation. So you get opportunities to do these procedures, and it makes you a competent internist in the future.
Wonderful. As I'm trying to understand this, it's very overwhelming that you get to do a lot of things as a resident. But as they say, not everything goes right. So there might be times where you fail. There might be times where you mess up as a resident because you're still learning. So how well do you think the department is protective of you, for you, and to teach?
So last week, I was during my rounds. I was occupied with another patient who wasn't mine. Uh, So what happened was that I attended a patient that wasn't mine. So my attending verbally berated me in front of my colleagues, and he said, is this your patient? Are you going to write a note on this patient? It isn't a cardiac arrest where it needs everyone to be around. It's not a life-threatening emergency. So the ultimate responsibility falls on your attending physician, the consultant or the specialist who leads the team. So we are supervised, and our backs are covered. Of course, we should not make any error, because if we do, God forbid, the questions would go to the consultant, because we are still trainees. We are still in the process of learning. So when you learn, we are humans. We make errors, and that's how we learn. And the program is very protective, because they know we are humans. They anticipate this. This is the whole purpose of teaching. We teach because we teach to avoid mistakes. We are teaching because people make mistakes, and we teach them to not to repeat the same mistake. So the program is very protective. Yes, of course, if God forbid you have made an error, you are bound to get a beating, I mean, verbally, but that's part and parcel of the training. So, it's on a professional level, it's nothing personal. So just take it on a professional level, learn for your experience, avoid the same predicament in the future, and yeah, go ahead. The program is very protective about it. They are there for you.
All right. I think let's just take a minute halt for the azan. It's the call to the prayer. So just
Sure,
let's
sure.
take. In the
All right.
meantime, see people just writing down questions on the chat. They can continue doing so, and we will review them at the end of the session.
Sure.
All right, we can be back. I think everyone is still here, thankfully. All right, I think we spoke much about it, and we are just nearing to the end. I just have a few things that many people usually have a doubt about. So, what's the scope like after residency in internal medicine? What do you think as once you finish your residency? What are your scopes? Because everyone's eyeing the future like 5 years down the line.
A very valid question, and I must say that's an important question. For someone who is into the program, what is the scope? I mean, what can I do after I get out of this program finally? Uh, I must say that the scope is wide, it's brilliant. Uh, for the local Emirati graduates, you have the International Fellowship Training Program in Ireland, which is the RCPI. For the non-local population, you can go out to the US or the UK or or Canada even. As I understand, our program is ACGME International Accredited. That means you are accredited by the Accreditation Council for Graduate Medical Education with international version. So the accrediting body in the US has recognized our program. That's number one. Number two, it's an Arab board slash Jordanian board accredited program. Three, we just got the Emirati board accreditation. So Emirati board accreditation is a tier one accreditation, which means that if a resident, and I think this is for all residents, if a resident is a graduate from an Emirati board program, you are eligible for a tier one consultancy job as the job of a consultant in the department. And that's a great news for us. And they are getting accredited for all the programs including surgery. The other thing being that we are in the process of getting the Canadian board accreditation, which means that if I think, as I heard, these are again just talks. Uh, that if we get Canadian board certified program, we can give the Canadian board exams and go for a fellowship in Canada. So your outreach after the internal medicine program is very wide because internal medicine program has a list of specialties, ranging from neurology to nephrology, rheumatology. And as I understand, in some countries like the US, neurology is a separate specialty by itself. So you can go for a residency or a fellowship in neurology after finishing internal medicine if you're interested in neurology. Many candidates have gone to the United Kingdom to do their specialty training in gastroenterology, for example. So the outreach is wide, the scope is there. You can even go for a research experience if you want, if you're more of research oriented physician. So it's all up to you what you want to do, and there is scope for it. And our program is very supportive in this regard. So this experience will help you build your caliber as an internist if you wish to do your practice outside in internal medicine. So it's a great opportunity.
All right. Speaking of fellowships, do we have fellowship opportunities in UAE after we finish internal medicine residency?
Definitely, definitely. I'm great you asked me this question. Definitely. Uh, there is a website you can go to. You can type DOH Tanseek Fellowship Programs. It'll give you the list of the programs. As I can recall, you have Gastroenterology Fellowship in Sheikh Shakhbut Medical City. You have the cardiology fellowship in Sheikh Khalifa Medical City. You have the infectious disease fellowship program in Tawam Hospital, that is under the leadership of my ex internal medicine program director, Dr. Akil Salim. He was the internal medicine program director until he gave up that post because he and along with his team introduced the infectious disease fellowship program, and we are planning to expand more. And yes, of course, you have rheumatology as well in Sheikh Shakhbut or Sheikh Khalifa, I'm not sure, but you have rheumatology fellowship as well. So you have these fellowships in UAE if you wish to continue in UAE. And you can find out on DOH Tanseek Fellowship. Just type this on Google search and you will get link to the page.
All right, perfect. I think that was a very good overview about the program and most of the, the core basics that people need to know about internal medicine. However, a final question that I would like to end it with is how would it's a timeline basically. How would you explain a day in the life of an internal medicine resident? So from the time you go to the hospital till the time do you leave, what time you start, what time you end, and how what departments do you go to? Basically, a day in the life of an internal medicine resident.
So, honestly speaking, a day in the life of an internal medicine resident is fruitful in so many ways. It's fruitful. I mean, I'm just being as safe as possible I can over here on camera. I mean, it's fruitful. Dr. Mustafa, to be completely honest with you, any program you are in, you will have to face a level of stress. You know, we've been facing that ever since we joined medicine. You know, we get jealous of seeing engineers who finished and got married early compared to us. But come on, man, we're working here to save their lives. You know,
Definitely.
excuse my language, we're saving their butts. So, so a day in the life of any resident is always stressful. It's fruitful, stressful. You know, there are always ups and downs, particularly in internal medicine. I love it. You know, I wake up in the morning, I pre round on my patients, I then round with my consultants. We do workups, we alter our management plans. And then at the end of the day, we ensure that the patient is stable. If any endorsements are there, we endorse it to the on call and then we leave. So that's when you are during work during the day. During the night, you do your on calls, 24-hour on calls, 12 hours on calls, weekend on calls. You get your own due weekend offs. You're not slaughtered like a lamb. All right. So you do get your offs. We have stress debusters activities. You know, we get invitations to do a gathering at the house of our current program director. You know, she has a farm. She's from here, so she has a farm, and we get invited for farm activities. We residents have our own hangouts at the deserts. Uh, Females who wish to have their own female hangout organized and go ahead with that. I do not know why. I mean, I'm a kind of an outgoing person, so I mean, we do these activities. You know, we go out. We even during my first year, we went for go karting in Alain. So you know, your life is fun. It's not just work, work, work. You know, you all work and no play will make us, you know, drowsy and dull. So you do get your due break. uh, you know, we do these activities amongst ourselves to make sure that our life is joyful. uh, yeah, when we work we have to be responsible. We feel, you know, stressed, we might end up getting burnt out. God forbid if that happens, there are people around you can talk to. You can talk to the program coordinator, or you can directly talk to the program director and say this, you know, I'm going through this. They will sit with you privately, have a one-on-one discussion. They're very supportive, you know, they're very keen to help you. If you need help, do not hesitate to ask for it. They will help you. You know, it's not just your working, you know, whatever you go through, you will make friends, you will chit chat, you will, you know, take out what you feel. People are there to talk to you, people are there to help you. So help is always there. And yeah, it's a nice place. It's fruitful again.
That's really, it's a very good point that you highlighted it out, that because when you get into stress or you are burnt out, you need some time to detox from that as well. And as the famous saying goes, if you enjoy your work, if you enjoy the stress that the work gives you, you're not going to work a single day in your life. So it's all a part and process on how you take each day. However, it's a core specialty. Let's not forget that it's going to be overwhelming, but it all depends on how we manage or we take care of ourselves. And that's rightly said by you that, all work and no play obviously makes you dull. So keeping this balance itself will let us become competent internists and physicians in the future. All right, that was really good talk. How about let's answer some of the questions that they put it up in the chat for us, because I think there are some
Sure,
things we,
sure.
we might.
You would like me to answer some of their questions? I'm available. That's that.
Yes. Let me just see what they asked so that I can tell you. I think we discussed about the Emory score. People asked about it, and
Right.
They asked us actually about interviews. We haven't touched on that. How
Right.
do you feel the interview process? Is it face to face, hybrid, and how? What do you expect from an interview?
Right. So in the interview process, during my interview, which was 2 years ago, it was online through a webcam. Uh, and I think this year they will bring face to face because we are now in the new normal of the post COVID era. So whether it's distant or face to face, an interview is an interview nonetheless. You know, you have to present yourself on time, be calm, do not. It's okay to be nervous, but just when you get nervous, you know, if you're in an online interview, one trick is that if you get nervous, just clench your fist or squeeze a ball, you know, in your hand, and no one will notice, and that'll kind of help you. If you are face to face, just when you sit down, you're sitting on a table across them on a chair, so your hands will not be shown. Just tug your hands under your thighs and sit relaxed, and just take some slow deep breaths and talk about yourself in during an interview. So these are some tricks that can help you for the interview. Be yourself, represent what you have written in your CV. uh, Prepare for your interviews. You know, do not just go in blindly. uh, for my interview preparation, I did watch some videos on YouTube, you know, how US program directors interview applicants and what are the pros and cons of acing an interview. So just open any YouTube links and which can help you. Having said that, after the interview, do not think about what happened during the interview. You did your best. Leave it to God. Godspeed. Whatever happened will happen for the best.
So, in the interviews that we are discussing, do they ask you personal information or academic based information, or what's the balance like?
During the interviews, it depends on the interviewer. I'm not sure about the other programs, um, but in my program, I was asked personally, academically, experience wise. You know, they covered few areas from my CV. uh, they also asked about my language efficiency, occupational language efficiency. Apart from that, just a general overview about where you live, what do you wish to become, you know, 5 10 years down the line, up, you know, after this program. What would you do for the program? What do you expect from the program? Why this program? Why this hospital? You know, why internal medicine? You know, these are all the questions that you have to anticipate and be prepared in your mind. You know, you have to prepare your answers for that.
Okay, perfect. That makes sense. There's someone who actually asked a question that if they are transferring from one specialty to the other, and if that was to come up at the interview, how do you manage or tackle that kind of a question? If they're transferring other specialty to internal medicine.
I'm not very familiar with this question. Does the question entail like if you are already in a program, or if you are working in
Yes.
a department as a GP and you want to shift your practice into internal medicine? What does it entail? I'm not following the question correctly.
I think we can answer both of them because it's not clearly mentioned. But I think if you are in a specialty and then you are shifting to internal medicine, how do you handle that during the interview?
Right. So if you are practicing in a different specialty and you want to transfer into internal medicine, you need to have strong justification as to why you wish to do this. Because let's say I am in the interviewer's chair and you come to me from pediatrics, for example. You're working as a GP in pediatrics and you wish to do an internal medicine. I mean, you're in pediatrics. Why would I want to take you in internal medicine? Number one. Number two, you are in internal medicine. What is the guarantee that you might leave and go back to pediatrics if you're not happy with internal medicine? So these are the questions that could rise in the interviewer's mind, and we need to anticipate that and be prepared to justify our case So I think in that regard, you have to build your experience in internal medicine if you're practicing in another specialty. If you're within the program, for non Emiratis, the chances of transferring is very minimal. So it's advisable that, if you are applying to internal medicine, apply to internal medicine from the start. Do not have this mindset of transferring. It is a red flag, and it may not look good on your CV and in your practice in the future.